Are you suffering from low back pain with tightness and weakness in one side as well as spasms, especially your sacroiliac joint? Hi, my name is Annie and welcome back to my channel, Annie Pilates Physical Therapist. In this video, I'll be discussing about sacroiliac dysfunction and why it's so common, usually mostly for women because of the childbearing age as well as the ligamental issues that could happen when you have too much flexibility and lack of stability. So in this video, I'll be discussing why it's common for postpartum women to have this condition, as well as for men if they hurt their back due to prolonged sitting position. And that's why we need to improve the stability of your pelvis and not just cracking it, going to a lot of flexibility training, not realizing you need stability before flexibility to decrease the inflammation on this area. So if you look at this diagram of the pelvis, women has a heart shape, men is usually a little bit more triangle. The purpose of the heart shape is for childbearing, so you can have more space for the baby. And when you have normal delivery, even for C-section, what happens with the hormones of giving birth, the relaxin hormone to help you expand those joints, because the sacroiliac joint is a joint that's a little bit movable, which means you can move it in time like your teeth. So your teeth is movable with brace. So the SI joint is a joint that moves a little bit to expand for pregnancy, and it's also open up more until you can really expand your pelvis so that the baby could pass down to the birth canal, that we open up to 10 centimeter when you're ready to push the baby out. And that's why women, after giving birth, they have a lot of back aches and sometimes one-sided, which is usually your weaker side. So I experienced sacroiliac dysfunction during my pregnancies, especially when I have a tailbone injury from snowboarding many years ago, that it came back again. And if you have instability on one side, sometimes your pubic bone gets irritated as well. That causes pubic symphysis, because it's a 3 bones on the left, 3 bones on the right. These bones are fused together, but they're movable. So that's why if you have anterior rotation and posterior rotation on one side and a tilt in one side, especially it tilts down on your weaker side. So I have my left side lower, the lateral tilt in my left, and then a little bit anterior rotation. So it pushes forward, that causes this pelvic dysfunction. So today I'm going to use a foam roller to connect. We need to connect it together. So we're going to do some muscle energy techniques, some a little bit posterior pelvic tilt and anterior tilt to slowly mobilize that area safely, to let it breathe, gentle mobility to take it breathable movement. So when you do internal rotation of your toes like this, you're going to feel an opening here on your SI joint, and external rotation is when you contract. So when you do deep squats and you're not strong enough, you can give out on your SI joint. So let's begin the program now. This is a soft foam roller that is squishable, and if you need a soft foam roller, check the description below, comment foam, and I can send you the link on how to get this foam roller that I created that's soft and tolerable with my program. And if you need my help and guidance for my upcoming challenge, my Revive Pelvic Floor Health Core Rehab April 8, comment down below Revive, and I'll send you the link, or you can click on the description below and sign up for the first come, first serve. 100 people spots only, so I could join the challenge this April for 8 weeks to resolve your postpartum pelvic floor back pain situation to finally revive your pelvic floor health. So let's begin the program. We're gonna lie on your back, and as I said, this soft foam roller is doable. So my left side is my weaker side. So how do you know which one is your weaker side? You can check it by placing your hands on this bony prominence on your hip joint, on your pelvic joints. This is the ASIS. So for me, as I bridge first and as I go down, and I could feel as I point my left to my right and connect it in the middle, my left side is a little bit lower. So as I slowly bridge again and down, and you're gonna double check again, and yes, that's right. So when you extend your legs, you can look down on your feet and you can feel one of your foot is a little bit further down, even a few centimeters against the other leg. So my left foot is further down compared to my right. So now how do I make it a little bit elevated on my left, the lateral tilt with the SI joint pain? My first recommendation is to do proper breath work. So you take a deep breath Expand abdominal muscles. Exhale and then zip it up and press your back against the mat. You might feel a dull aching pain across your back, and that's part of the gentle mobilization I'm talking about. So I'm pushing against the mat. As I breathe in, I'm slowly relaxing it in a neutral spine where I could place my small of my hand at the small of my back. So my back of my hand at the small of my back, so I could place it there. As I breathe in, expand my abdominal muscles, and then exhale, zip it up, squeeze my core in as I gently breathe out through my mouth and pressing against the mat. Inhale, expand, and then glide the back of my hand against the small of my back. Not overarching that anterior pelvic tilt, just glide. Because when you overarch, you can feel some more spasm and tension. You don't want that. And then exhale, zip it up. Inhale, expand, and exhale, zip it up. So after that beautiful breath work and gentle anterior tilt, posterior pelvic tilt by pressing, grab the foam roller and place it on top of my left thigh, my weaker side, and then my right thigh behind the foam roller. So the purpose of that, as I lift my leg up like this, you're gonna feel some tension, and I'm pressing my left thigh against the foam roller, keeping it straight without twisting, and my right thigh pressing against it. So I'm pulling my left knee towards me, and then I'm pressing the back of my right thigh away from me, while my knees are bent in 90-degree position. And hold this for at least 10 seconds. And if it's too much on your back, then you can do it even 2 seconds. 2 to 10 seconds as you slowly progress. You're going to feel some deep ache release on the side of your weakness. Again, lift it up, tabletop position. As I breathe in and breathe out and press against it, I'm pulling my left knee towards me. I'm keeping my right thigh behind my hamstrings against the foam roller and press. And this is very soft, so it's doable. It's not going to create pain on your thigh muscles. And do this 10 reps. Inhale, exhale. And you might start getting fatigue. 2 more. Breathe in, breathe out. And my recommendation is do this 10 repetitions, but for absolute beginners, you can do 5 seconds hold for now and 5 reps. Last one. Well done. And after doing that, now let's build it together by squeezing the foam roller between your thighs and squeeze as hard as you can. You can feel some tension on your pubis and your hip adductors as you breathe in. Breathe out, squeeze as hard as you can. Placing your hands on your abdomen so you can feel your breath. Inhale, expand. Relax your thighs, don't press, and then press together. And hold this for 5 seconds for beginners until you can progress to 10 seconds. Inhale, exhale, press. So today we'll do 5 reps only. Let me know if you want to do a follow along video. Just leave a comment down below. Last one. Exhale, press. Well done. Now, after that beautiful squeezing together, now hold on down to the side of the mat for support. Take a deep breath. Now we're going to glue it together further by squeezing your glutes as you bridge and squeezing the foam rollers together, and breathe out. Inhale. Expand your abdominal muscles. Exhale, zip it up and slowly roll down. 1 vertebrae at a time and relax. Inhale. Exhale, squeeze the foam roller and squeeze your glutes as you lift. Inhale. Exhale, roll down. 1 vertebrae at a time. You might feel fatigue now on your hip adductors. As I said, with SI joint dysfunction, it affects your pelvic floor as well. 2 more. Squeeze as hard as you can. Squeeze the foam roller. Inhale again. You relax the core as you breathe in, and exhale, squeeze it up, zip it up from your lower abs to your navel, up and in, and slowly roll down while squeezing your glutes and squeezing the foam roller. Last set. Inhale. Exhale, squeeze and lift. Inhale. Exhale, down. Well done. So after doing this beautiful movement, now let's further strengthen and glide that foam roller. So the right side is my good side and my left side is my bad side. So let's start with your left side first. So I'm gonna roll the foam roller back if the top side is the good side, and hold it for 5, 4, 3, 2, 1. So my right knee is further behind my left knee, and the foam roller is my guidance to roll it back to neutral. So what I'm doing, remember I told you about the anterior rotation, I'm pulling to posterior rotation on my right side, and then back. So it's a gentle stretch on my SI joint. I'm making it further anterior rotation on my left, but without pain. Keeping my spine in neutral position. So this is what's happening as I glide back. So I'm pulling back on the top area. Just a few inches back. Last set, and do this up to 10 repetitions, up to 10 seconds hold, slow and gentle movement, because the SI joint is a gentle movement. It's not like your hip joint that you can't keep lifting it up with your mobility. So now let's switch to the other side. I'm placing this over my leg, and then as I described earlier, I'm gonna glide this time forward. The top part is my SI joint that's hurting, and I'm gliding it forward. I'm gonna feel a deep stretch and then back. Just gentle movement. So this one is the area where I have rotation backward. So I'm going to pull it forward and then back. So usually it goes back, lateral tilt and pull back. And that's what I'm pulling it back right now. As I go forward, I'm pulling it forward. So as I said earlier, tilt down and pull back. So I need to pull it forward and then back. So 5 seconds hold. So this one is my weaker side, as I said, it's tilted down. And then I need to level it to my knee, and I'm tilting it, I'm pushing it forward to tilt forward to help that alignment. Because it's not just tilting down for SI joint, there's rotation happening. So this area is where I tilted it back. It pulls my pubis on my left, and it pulls my SI joint on my left. Compressed and push back. So as I said again, tilt down and pull back. And sometimes there's also push down and rotate it towards the front. So you want to make sure you know which one is your rotation. For me, going forward, you can feel some relief as you go forward. As I said earlier, I have a lateral shift down and rotated anteriorly. So there's a little bit torsion happening. So lateral rotation, not just a tilt, but a little bit rotation towards my left side is where it's pinching. So it's pushed back posteriorly. Posteriorly means back and down. So what I'm doing, I'm going forward to release that tension and hold it for 5 seconds, hold, and 10 times. As I said, if you can't tolerate it, the gentle a few inches off forward. So my left knee now is further than the right knee, and that helps the gentle release on my left SI joint. And as I go back to neutral, as I take a deep breath, exhale slowly, push it forward. And that's a gentle, beautiful rotation happening to my tilt, and do that 5 seconds, hold 10 times. And after doing those beautiful alignment movements, as I said, lateral rotation earlier, is that tilt down and sometimes posteriorly rotated or anteriorly. So how do you find that? You can feel some tension. You can experiment which one you feel relief as you glide forward and back. So what I did on the right side, I went backward, because I feel like my left side is usually where I'm down and rotated backwards. So I have to go forward in this one to release it. And then my right side has to go backward to slowly realign that pelvis, especially when you have inflammation. And after doing that, now you can do a little bit clamshell as I squeeze together and lift. So I'm going to make sure as I lift, keeping the foam roller there. And as I go down, I want to squeeze the foam roller to activate my glutes and my external rotators. And then lifting both feet up and then down and then up. So clam with the soft foam roller. Take a deep breath, exhale, and then lift. Just gentle movement, not too much. Open, back squeeze the foam roller and lift. 3 more. Feels so good on your pelvis. So I'm leaning on my good side, and this is my bad SI joint. You can do both sides, but my recommendation is to do extra sets on the bad hip, bad pelvis area. Last set. And after doing that, hip hiking is one of my best exercises, and you're gonna use the foam roller. This is soft, so you can lean on it, all fours. So hip hiking is when you're gonna do a gentle movement in quadruped position. So I'm gonna go to the edge of the foam roller, right knee here, and my left knee is dangling. So this is 3-inch diameter. There's also 6 inches that you could check out in my website. And I could lean on my right knee. If this is too much, put an extra pillow, but this is very soft. It feels like a pillow. And then all fours, I'm gonna glide down, tap my left knee on the floor and up. As you get stronger, you can go up to 6 inches and stack up more pillows as you get stronger. So I'm really lifting my left side and back. I'm mobilizing that area. Take a deep breath, exhale, lift. 2 more. And do that 10 repetitions up to 2 sets. And that's it. I'm hoping you learned a lot about lateral pelvic tilt with rotation. And if you have any questions about this, you can also join my back masterclass, as I'm going to have a one-on-one coaching very soon. If you're interested to join my coaching calls, video calls, click the link on the description below. I can't wait to guide you, hold your hand to finally fix your back pain and have this coaching from me with my back masterclass. I'm hoping to see you inside my next opening up my registration very soon. Click down below, write your name and email address so you can receive the email notification on how to join for an early bird waitlist for first come first serve basis. Until my next video training, if you have more time today, check out this video about quadratus lumborum pain and this video about piriformis syndrome. Until my next video training, always remember, be safe, be well, and healthy you. Bye!